What are the main questions patients ask you on an initial consultation?
So it varies so dramatically. I heard this once, and it's so true. If you've seen one EDS patient, you've seen one EDS patient. I definitely feel like I've learned so much, and I'm so grateful to all of my patients and my clients for, helping teach me what these conditions are and what they involve. And boy, you can definitely say the same thing for mast cell activation syndrome. If you've seen one, Dr. Afrin says this all the time. If you have seen one patient with mast cell activation syndrome, you have seen one patient with mast cell activation syndrome. There are commonalities, but there's definitely differences. And it will be anything from, the youngest I think that I've done a consultation for was with the parents of a 13-month-old. And that's the other thing is consultations. I feel much more comfortable doing a consultation for a very, very young child than for, taking someone as a patient, because I also feel like a lot of times there's not a lot that they need to do. So for example, I recently saw, not that anyone's going to know who this was, but in the interest of complete confidentiality, I won't even give the age, but this person was in single digits, was doing cheer and was having some problems. And I'm really glad that I saw them this way as compared to seeing them as a patient, because it would have cost them more money to see me as a patient. And there wouldn't have been anything additional that I would have offered to them as a patient as compared to seeing them as a client. There wasn't anything that they needed from me that I couldn't offer to them on the Bendy Bodies, client platform, because for that person, they needed to know what type of activity modification was most appropriate. What should they be thinking about? What should they be watching for? And I don't think that in someone who's higher functioning and younger like that, or I don't want to prescribe any medications. I didn't even recommend any supplements, because in that instance, the last thing I want to do is over medicalize someone. I want kids to be kids. I've certainly seen young people that have been in a wheelchair. I've seen people in wheelchairs at age 16, probably even younger than that too, but I can distinctly remember a couple of people that were in wheelchairs around age 16, and we got them out of the wheelchair and got them functioning a lot better. So these conditions are so highly variable and can just really affect people very differently.